With a mountain of trust in God and a molehill of financial resources, and with Christian charity and compassion as the motivation, we said yes, while realistically anticipating the sacrifices which might be involved. The yes meant agreeing to build a hospital that would lead to what is now Holy Family Memorial. The choice wasn't an easy one.
When local Manitowoc doctors asked the Franciscan Sisters of Christian Charity to establish a hospital in the late 1890s, the mission was simple: to serve the impoverished of Manitowoc County, since only the wealthy could afford to bring caregivers into their homes. It was a worthy cause, and also a costly one, the equivalent of nearly $2.5 million today. Community contributions totaled just $112,000, leaving the sisters to add to their existing debt from their mother house. However, with unwavering trust in God and a special place in her heart for the sick, Mother Alexia, Superior General of the Franciscan Sisters in 1899, decided to move forward. And once complete, Holy Family Hospital was hailed as the most modern of its kind in Wisconsin. This was the beginning and has been the history of the Hospital on the Hill in Manitowoc. Each time more resources were required to meet growing needs, the sisters trusted in divine providence and maintained a steady commitment to caring for their community's sick and injured. The words of Mother Alexia were always in the hearts of those making decisions to move forward. Under such trying circumstances, it was evident that human means were not to be the foundation of the edifice in question. No, it was to rest upon a foundation more solid and more secure than earthly goods: trust in divine providence. During the first 2 years, the sisters paid for all hospital operating costs and even provided the coal to power the hospital for the first 8 years. They also volunteered all of their time spent at the hospital, and in the first 25 years had donated the equivalent of more than 11 million of today's dollars in professional services. Though while quickly cemented as an indispensable asset to the community, the hospital struggled to sustain itself and continued to pose a financial liability to the convent. Hospitals in the early 1900s were often viewed as places for people with contagious diseases, not necessarily places of healing. Only 2,500 people were served during the first 10 years, an average of only 20 patients a month. Although during the late teens and early 20s, that perception began to change. In 1923, 2,000 patients were cared for in just 1 year, and there was a need for more facilities. 36 sisters were working in the hospital and slept in 8-hour shifts in closets and unventilated rooms to give space to the patients. While still in debt from the original construction, the sisters made the commitment for a new addition in 1924. The new addition was just a small step to meet the community's ever-growing needs. The necessity for more space prompted the sisters to call a meeting of local businessmen to devise ways and means for providing more space for the sick and injured. According to the Tuesday, July 8, 1924 edition of the Manitowoc Herald News, the first advisory board was founded. Soon thereafter, in 1925, the Florence Nightingale Society, Holy Family Hospital's first volunteer group, was formed. In 1927, after a thorough study of the hospital's financial situation and the healthcare needs of Manitowoc County, the sisters and the advisory committee embarked on a public campaign to raise money for a 100-bed addition. The people of Manitowoc County generously supported the project, donating what today would be $3.5 million for the more than $4 million building. With steadfast faith in God, they moved forward with the project. The 1920s also saw a rebirth of a nursing training school to meet the staffing needs of the growing community and hospital. Originally started in 1909 and operated for a few years, the school was discontinued due to a lack of student facilities. With foresight and planning, it reopened on October 4, 1920, the Feast of St. Francis. Classes were taught by the doctors and sisters, and it remained open for more than 50 years. The Depression years and accompanying drought were especially hard on the Manitowoc community.
Men came to the back door by the dozens for a handout. They were thankful for any kind of food. We gave some food to each one, no matter how many came, and somehow or another we didn't miss it. During the Depression, we at the hospital didn't feel it the same as those outside our walls. The house was heated and lighted the same as always. See how God has treated us.
The 1940s war years brought many challenges, along with many innovations. 38 local nursing school graduates answered the call and served in the armed forces throughout the world. In 1940, students began commuting to Silver Lake College of the Holy Family for classes in religious studies, literature, and physical, biological, and social sciences. In 1945, the War Production Board approved a request by Holy Family to build a dormitory for student nurses. 1940 also saw an iron lung put in service to treat polio patients, with a dedicated polio isolation unit established in 1946. The late 40s were boom years for Manitowoc, with businesses focusing on industrial and economic growth. And the accompanying baby boom kept the nursery busy. In March of 1947, Sister Raymond Fox announced a $5.5 million addition to keep up with the growth of the pediatric population. When complete, the entire hospital complex could now serve 250 patients. The addition stands today and houses administrative offices and clinics. Innovations continued into the 50s. The hospital, accredited by the American College of Surgeons since its early days, gained accreditation from the Joint Commission on Accreditation of Hospitals in 1953 and again in 1957. The physical therapy department expanded, and a pathology lab, blood bank, post-operative recovery room, and central service department were all created. With the city growing, a group of interested community members formed a corporation to build a new hospital on the north side of Manitowoc as a memorial for all war veterans of Manitowoc County. Aptly named Manitowoc Memorial Hospital, the 50-bed hospital served its first patients on July 23, 1953, and was expanded in 1962 and again in 1972 to become an 87-bed hospital. At Holy Family Hospital, the biggest event of the 60s, literally and figuratively, was the construction of a 7-story high addition, which still houses the HFM inpatient unit today, along with 2 floors added to the 1949 wing. A volunteer hospital guild performed major fundraising to help pay for the project, as well as the launch of an intensive and coronary care unit. Continued growth and innovation charged forward into the 1970s. No longer able to be used for patient care, most of the original 1899 facility was demolished in 1973. The School of Nursing graduated its last class in 1976, as educational trends turned away from 3-year diploma degree programs to associate or bachelor's degree programs. And around-the-clock physician coverage in the ER became a standard in 1979. Throughout its history, Holy Family has required new buildings every 20 to 25 years. The 1980s brought the replacement of the facilities constructed in 1924 and 29, which had housed a skilled nursing facility since the 60s. In their places came a new building for therapy services, social services, respiratory services, pastoral care, purchasing, central supply, a print shop, housekeeping, and a new chapel. Other expanded services such as home health care, hospice, and caravan services were also launched in the 80s. The 90s started boldly with the Manitowoc Memorial Hospital and Holy Family Medical Center boards of directors announcing they would pursue a merger. On March 28, 1991, the merger was approved by the Federal Trade Commission and the Department of Justice of the state of Wisconsin. The name of the new entity, Holy Family Memorial, honored the history of both institutions. The 90s also brought the beginning of Holy Family Memorial Health Network, which included many local clinics affiliating with Holy Family Memorial. As the decade ended, a two-story cancer center was added to the 1965 building. It offered the most modern options for cancer treatment. During the first decade of the 21st century, Holy Family Memorial grew into a community-focused healthcare delivery system, offering a full range of services, including a hospital, a 90 practitioner multi-specialty group, and a regional orthopedic program. A new campus on the far west side of Manitowoc, known as HFM Harbortown, was built to house a comprehensive outpatient unit and wellness center. It opened its doors in October 2005. The hospital, located on Western Avenue, added a new building in 2006, which included a heart and vascular center and a modern diagnostic imaging facility, replacing the one which had been housed in the 1965 edition. Always reaching out to help others, the decision was made in 2016 to combine two HFM clinics and a rehab facility into a new clinic, the HFM Lakefront campus. The new modern facility renewed a visually neglected property in Two Rivers with a beautiful complex that brought additional HFM services to the community. Doors opened on October 2, 2017 to the bright, attractive clinic, which added a lab, diagnostic imaging area, and mental health counseling to the primary care and rehab services already provided by HFM in Two Rivers.
For 120 years, from day one of Holy Family Memorial to the present, the Franciscan Sisters of Christian Charity have committed their hearts and their resources to take care of the sick and injured of Manitowoc County, while always looking for new ways to improve community health. Looking back to our trust in divine providence, while looking forward to the challenges and opportunities ahead, I have faith in the words of St. Francis of Assisi. Have confidence in the Lord. He will be your help and provide whatever is necessary for His work.